Welcome friends, you're welcome to Anesthetic Crunch. Friends, I'm Nisarga and today I'm going to tell you something about anesthesia. So friends, what were the old anesthesia methods? What are the present anesthesia methods? Means the modern methods. How are they used? What were the agents? What are the agents? And I'm going to tell you everything about anesthesia. So friends, let's get started. As I told you, today's topic is going to be anesthesia, so let's get started. So friends, if you had a surgery before, you must have counted at 1, 2, 3, 4 and even reaching before 20 or 30, you must have come to know that your surgery is finished. So how this happened? What happened when you was asleep? You think that you was asleep but you was unconscious. Friends, anesthesia is a very complex method in which you are unconscious and as well as you can't move. So friend, anesthesia, old scripts from some parts of India that describe world anesthetics are Middle East, Asia and Egypt. Friends, they use agents like opium poppy, mandrake fruit and alcohol. So friend, these three were the agents which we used in the past, and there are some more agents which are used but we will not go in deep. So these were the most common agents that were used for anesthesia in the past. And friends, today in modern world we also use new methods. There are three modern methods such as regional anesthetics, inhalational anesthetic and intravenous anesthetics. So friends, let's get started with regional anesthetics. Friends, in regional anesthetics, the anesthetics work only on a particular part of a body. Means if you are having a surgery of your palm, so regional anesthetics will trigger the sensation of only the palm, not of the whole body or your whole nervous system. So friend, what happens? The regional anesthetics makes a bond with the membrane in the neuron membrane with the protein. So friends, when it makes a bond with the proteins, it blocks the electrical signals. Friend, you must know that all the messages or we can say pain messages, all the messages in our bodies are carried out through electrical impulses. So friends, when the brain receives the electrical impulse, the electrical impulse is blocked by the agents used in regional anesthetics, and it allows only the negative pulse to pass and blocks the positive pulse, so brain cannot detect the pain. So they are very helpful, because if there were no anesthetics, the surgeries we perform today will more dramatic and no one will perform them, and this will lead to very deaths. Because friends, if there is so much pain, why would one like to make the surgery? The cancer surgeries, angioplastics, such there are so dramatic surgeries without anesthesia. It would cause the patients a huge pain and no one will like to have such surgeries. So friend, anesthesia plays a very big role in today's modern medical surgeries. So friend, second comes, that is inhalational anesthetics. So friend, in inhalational anesthetics, many a times it is used with the third type of anesthetic, that is intravenous anesthetics. So friend, the many a times that inhalational anesthetics is combined with intravenous anesthetics to make it balanced. So friend, in intravenous in inhalational anesthetics, it makes the whole nervous system unconscious. So friend, in inhalation anesthetics are usually used in very dramatic surgeries like angioplasty. So friend, in inhalation anesthetics, some agents are used like dimethyl ether. Friends, dimethyl ether was used in old days and nowadays it is used very less. And friends, there is one side effect of dimethyl ether, that when it is used on patients, under its influence the patients can't feel the injuries also that are caused. Means if you are having an injury in your hand, you are having a big cut in your hand, you can't feel it after the surgery also. So friend, that can be very dangerous, as there is a cut, it can lead to blood loss, and blood loss is always fatal, it can take your life. So friend, that's why dimethyl ether was used less. And in 1840s, in 1840s some new agents were used, like in 1840s actually the dimethyl ether was used for dental extractions and surgeries, but in very less quantity. And also nitrous oxide was used, which you know is used also today. And more common than nitrous oxide was sevoflurane, that was also one kind of inhalational anesthetics. So friend, inhalational anesthetics are very important, and they actually slow down the motion in our mind. So friend, as you know, there is constant motion in our mind about various things which we don't know a lot about them, friends, but we know that there are some motions, and when we take such anesthetics, so they slow down the motion. So friends, as I told you that inhalation anesthetics are used with intravenous anesthetics. So friends, intravenous anesthetics include propyl and fentanyl. So friends, propyl promotes unconsciousness, and fentanyl promotes means it does not promote, it actually reduces pain. And friends, now we will know how several anesthetics work. Friends, several anesthetic works by blocking the electrical impulses in the GABA receptor in our brain. So friend, it makes that, which I told you earlier, that it blocks the negative signals and allows the it blocks the positive signal and allows the negative signal to pass, which is then not identified by our brain, and we don't feel pain. So friend, the old anesthesias damage our body, and they damage actually not our body, they damage our vital organs like lungs and heart. Some of the examples are hemlock and aconite. They were very dangerous. And friends, even modern day anesthetics are very dangerous, and they can cause severe harms to us, because friends, they can cause any much harm, but they don't, because the doctors use them in balanced proportion. So they are very important. So friend, without anesthesia we can't imagine the surgeries we perform today. So friend, new anesthesia comes and it increases the potential of the doctors, because when the new anesthesia comes, it removes the boundaries of the doctor, because when new anesthesia comes, it can be used in various surgeries and new surgeries, and more dramatic surgeries can be carried out actually. So friends, this was all about today anesthesia. I wish you liked the video. Friends, please like my video, subscribe to my channel, and share this video as much as you can with your belongings, near and dear ones. Let them know how anesthesia works. So friends, this was all about in today's video. Let's meet in next video. So bye bye.